aspiring actress Emily Chesterton tragically died after a fatal blood clot was misdiagnosed twice by a physician associate whose role is only meant to be to support doctors, requires just 2 years of specific training in the field.
Well, this week, Emily's parents, Marion and Brendan, are supporting legal action against the General Medical Council at the High Court, and we're going to talk to them in just a moment. Well, Emily's parents, Marion and Brendan, join us this morning alongside consultant anaesthetist Dr. Richard Marks, who's leading this particular campaign. It's so hard to watch that video of Emily. She feels so present, doesn't she? I know it's so hard for you. Such a beautiful, talented young woman. And just listening to Fran's report there on what happened when Emily went to see the physician's associate, one of the things that struck me, because I know that we've spoken to you before, but one of the things that struck me was that she was diagnosed with anxiety.
Correct.
I mean, she was not an anxious person. She was someone who was genuinely concerned about something that eventually led to her death. It feels like insult on top of the injury.
Yes, certainly. Yeah.
She was obviously anxious because she was feeling very, very sick. And she was, you know, she was breathless, she was coughing, she was in pain with her calf. So, yes, it wasn't just anxiety, but she was given a drug for anxiety. She was prescribed.
She had every reason to feel anxious.
Yeah.
And, in fact, if only she'd known that if she'd been able to see a doctor and the doctor then had sent her to A&E, her life would have been saved.
Yeah. And at the inquest, the doctor did say, you know, if I'd seen her, I would have sent her to A&E.
That's right.
So
on either occasion, if you know, if she'd been sent on either occasion, the first time she saw the PA, second time she saw the PA, they could very probably have saved her life.
The coroner said she should have been referred to A&E, and she wasn't, because she was seen by somebody who doesn't have the training and the experience to listen to what they're hearing, and then for that to trigger, there's something else not right here, there's something else going on. And in this case, the physician associate just missed what was happening.
Yeah, she did. She's very hard for us. And she was unsupervised. And she saw her twice consecutively. And she prescribed a drug for her, which did not help.
And Emily thought she was a doctor?
Yes, she thought she was a doctor. We believed she was a doctor, as you said before in your introduction, right until the week before the inquest, 5 months later. That was only when we were told that it was not a doctor, it was a physician's associate. And the first thing I said was, well, what is a physician's associate? I had to sit down, I remember, and I had to have a good few minutes to myself just thinking, what is going on?
Because Brendan, what does physician's associate suggest when you hear that phrase?
We've said and we've maintained that the name is rather grand. Physician's associate sounds even better than junior doctor. And so the name itself is something that we objected to. We told there's nothing that we can do about the naming of them. But it suggests someone who's highly trained, highly competent. And, you know, people I've talked to, they say, you know, a pain in the calf is like medical 101. You know, everybody should realise that is indicative of some sort of clot, and she didn't notify that.
It's so shocking.
Dr. Richard Marks, you're a consultant anaesthetist, and there are also anaesthetist associates, aren't there?
Yeah.
So, I mean, what do they do?
So anaesthesia associates do an analogous job to physician's associates. When they were first launched, they were called assistants, and everyone understood what that meant. And then they changed the name from assistants to associates, which blurred it, and they've increased the number of them. So more and more patients are going to come across them.
What are you hoping to do with the legal action? So
the legal action is aimed at defining much more clearly what these associates can and cannot do, because at the moment it's just left up to the individual employers to decide. We think there should be nationally agreed guidelines set by experts that say what they can and can't do and define the levels of supervision much more closely.
And just to be clear, there are thousands, aren't there, of physician associates and anaesthetist associates. In this terrible case, Emily's tragic death, clearly the physician associate went way beyond her remit and her qualification and her expertise. But in general, are these physician associates doing a good, helpful, supportive job? Do you support the role that they play?
Well, the thing is, you can't answer that question without defining what that role is. I mean, every doctor would love to have an assistant, like who wouldn't? But is defining where assistance begins and ends and where autonomy and acting by themselves starts. And that seems to be the problem.
Marion, what would you like changed?
I'd like to be absolute clarity on what PA, AA can and cannot do.
Right.
Supervision is so vague at the moment. What is supervision? That needs sorting out, definitely.
The thing is that, as you say, a pain in the calf and shortness of breath, you would think that was an obvious critical situation. But if the physician's associate doesn't think it's a critical situation, what does the patient do in that situation?
Well, she trusted the doctor. You know, she came out and she said, "I've seen the doctor. The doctor said it's just anxiety." So, you know, I suppose it was a trust in the profession. So, you know, we didn't question that. We thought, well, the doctor said it's that, so...
You would have liked her to just have seen a doctor.
Yes, of course.
And we were reassured because she came out and she said it isn't anything serious. I'm being sent tomorrow for a chest X-ray. So that's the moment I was thinking, she doesn't look well. We'd seen her previously, 3 weeks previously, and what should we do? And because we believed she'd seen a doctor and she was going to the hospital the next day for an X-ray, we thought we trust in the doctors.
Can I ask what's gone wrong here? I mean, the law has changed. There's an order in Parliament saying that the General Medical Council is supposed to be in charge of this, but you are now suing them in court. I think they have to provide guidance by December about how this is to work. Is this a failure of the law or the National Health Service or the General Medical Council? Who is not doing what needs to be done?
Well, we think it's the General Medical Council. Certainly, when regulation was first proposed, everyone assumes that it would do what it says on the tin, which is to define what that role is. The General Medical Council are the only people. It can't be the NHS that defines it because there are associates who work outside the NHS.
Dr. Richard, I just wonder if I can put an alternative view, because I can imagine there's probably lots of people watching who are physicians' associates or who run GP surgeries or medical centres where they work very effectively. But how can we make sure that nothing like this happens? Are there certain conditions that the physician's associate should think, this is beyond my remit, I need to check with a doctor? Is that part of what you're trying to establish? Well, or is it that every single patient should be told they're being treated by a physician's associate and be given the option to say, actually, I want to see a doctor?
So there's a couple of things on that. First of all, you don't know what you don't know.
No.
And it's very easy in medicine to get into deep water without realising it. Secondly, I take your point. There are some PAs who are excellent and are doing an excellent job, but it's all about supervision. It's all about knowing what they should and shouldn't be doing, and when they're sort of getting off-piste.
And you hope that this legal action will clarify that?
That's the plan. Yeah.
Thank you very much indeed, and thank you for coming in again, Marion and Brendan. You know, what's happened? Losing your gorgeous daughter is just...
we don't want any other family to go through this hell.
No.
We want it sorted out for everyone, like you said, the PAs themselves.
Yes.
Patients, doctors. It's got to be clear, robust. Yeah. We need clarity, cohesion. We don't need vagueness.
Absolutely well said. Well, the General Medical Council told us that once the regulation is in place in December 2024, associates will have a responsibility to clearly communicate who they are and their role in the team, and added that they don't set a scope of practice that determines what individual professionals can do.
A Department of Health and Social Care spokesman said, "We are clear that physician associates should be supporting, not replacing doctors, and receive the appropriate level of supervision by healthcare organisations." Well, I guess the question is who decides what's appropriate, and that's what the General Medical Council needs to do. Your worry is that they are, at the moment, being unclear about that. That's the challenge.
Thank you very much indeed. If you're affected by that issue, you can find advice and support at itv.com/helplines.